You're listening to the Turn Autism Around podcast. I'm your host, Dr. Mary Barbera, and today I have a special interview with Jennifer Niemeyer, who is a mom as well as a professional in the autism field. Before I get to her introduction and this great interview, I did want to tell all of you now that it's April, my book, Turn Autism Around, an action guide for parents of young children with early signs of autism, is available, not just for pre-order, but it's available. It's out in hardback, on Audible, and on Kindle. Get all the information, including all the bonuses, at turnautismaround.com. Now, today we have Jennifer Niemeyer, who is the mom to 4 adult kids who all have had a diagnosis of autism in their past. And she's going to tell us all about her journey with autism and how her kids are doing now, which is amazing. And then Jennifer also shares her story of how she transitioned into the role as a board certified behavior analyst. And she's also a registered nurse. She's got a wealth of information, gives parents a lot of hope that things can always be turned around, regardless of age or ability level. Really, a lot of great gems. So let's get to this special interview with Jennifer. So Jennifer, thanks so much for joining us today. I'm so happy to have you here.
Thank you for inviting me. I'm really honored to be here.
Yeah, so we like to start. I heard a little bit about your journey, both professionally and personally. So why don't you tell our listeners how you got started, what your fall into the autism world was initially like?
Okay. Well, I started out as a nurse. I'm American. I moved to the Netherlands in 95, and I worked in the pediatric healthcare. We have like free clinics for young children here, and that was the work I did. I ran across a child at some point in time. I was studying to be a nurse practitioner, and there was a young child with signs of autism. Now, when I learned about the signs of autism, I followed a course on autism, and I recognized some signs of autism in my young children. My twins were 3 years old at the time. And I had already had some concerns. I had voiced that to my doctor, and he reassured me. He said, he said, with parents like you, they're going to be just fine. I wouldn't worry about it too much.
And this was like mid 90s, late 90s. What?
Yeah, that would be, no, it was actually 2005.
Okay.
Yeah.
Okay.
Yeah.
Okay. 2005 is when your young 3-year-old twins started showing signs.
Yes. Yes.
Okay.
Exactly. And so I wanted to be reassured, of course. I wanted to think that there's nothing wrong with my children. I was thrilled. Okay, I went on, but then I found, I learned more about autism, and I recognized the signs myself, and I brought them back to the doctor, and I said, look, I'm really concerned. And at the same time, they were growling at the doctor, and he voiced some concerns too. He apologized for not having seen it, and he referred me immediately for diagnostics.
Did they have language at that point? Did they talk? Were they having other problem behaviors?
They had a few words. They developed a few words here and there, but they would sometimes forget their words. And yeah, and
I call those pop-out words, where they have a word, but then it's gone, right, and you have no idea how to teach them. Well, now I know, and you know how to teach them, but at the time in 2005, it's confusing. Okay, so they had a few pop-out words. They were growling. Were they doing anything else? What were their signs? What concerned you?
Tantrum behavior. Not very quality eye contact either, and their speech development was so sporadic, and at that point in time, it had stopped entirely. They were not playing normally like other children. And they were biting each other constantly. I mean, they were black and blue, covered with bruises.
Wow.
Yeah, and I really was lost. I didn't know what to do. I was busy working mom, and I had a nanny at home, and I felt horrible. I felt guilty, thinking it's all my fault.
Okay. So then, once the doctor did refer you,
Yeah.
um, how did that go? Did you get a diagnosis for them?
Um, it took about 3 to 4 months. I mean, we were on a waiting list for a couple months before we got in. I had to put a lot of pressure on them to get me in. And in the meantime, I was already certain of the diagnosis. And before the diagnosis was even arranged, I had already found ABA as the most evidence based form of care, and I had already started reading up on it. So, yeah, I learned a lot. I think I read Catherine, let's see,
Catherine Maurice.
Catherine Maurice's book. Uh-huh.
Yeah.
Yeah. Yeah.
Let Me Hear Your Voice, which is the book I read, and really the book everybody read in the 1990s and 2000s. It was published in 1993. Okay, so they get a diagnosis at 3.5?
Yeah, 3 years, 3 months. Yeah.
Okay, 3 years, 3 months. And then then did they well, you also have two other children. So before we talk about, the twins progression, you also had two other children, and did they start to show some signs at that point, or was it later?
Well, they always had an unusual development, and they were rather difficult to raise. But when my youngest boys got a diagnosis, I said, well, if my youngest have autism, you better look at my other two. Because I recognized some different signs. They were much more verbal, but they had also signs of autism. And the more I researched autism, the more I thought, and I became concerned. So they did some diagnostics on the older children as well, and they recommended. They said at the time that my youngest boys would be in a facility for their whole life. They said they had very severe autism, very low IQ, and they said that my oldest daughter should be placed in a residential home, and they had some hope for my son because he has a high IQ. He was very verbal. Yeah.
So when your twins were 3, your older son was how old? 8, you said?
8 years old. Yeah.
Okay. And then your daughter was
13.
13.
Yeah.
So they started looking at your 8-year-old and your 13-year-old, and they were both of them diagnosed with autism as well?
Yeah, they've one had the oldest had various diagnoses, and there was a diagnosis of autism, a lighter form of autism, and the 8-year-old was also diagnosed with what they called an Asperger, but a higher functioning autism.
Yeah. So you had like 4 kids basically all diagnosed with some level of autism, all kind of back to back, starting with your twins' signs at 3. Wow, that's a lot for you and your husband. And you're a nurse, you're a behavior analyst, you're married to a physician, lots in common with me. So I can imagine how you and your husband were feeling at that point.
Right. Well, we felt rather lost and very much overwhelmed. Only I didn't have I really had to start looking into the future and thinking, what am I going to do? So I had to stay away from that, the guilt complex that I had. I had to let that go, and I had to, get over my, you have a tendency to you don't want to have a diagnosis for your kids at the same time. So I was definitely in denial for a while, but I had to get over that really fast And I just started looking at treatment options. And I was already so far that when these doctors said that, I said, what are you talking about? I've read other stories. I know that there are possibilities for my children, and I'm not going to let you tell me otherwise. And they didn't believe me. They didn't have the knowledge that I did as a parent at the time. So I just packed up my kids and left the country for a few months. And I found an organization in Arizona. I did a jumpstart program with the little ones. I took my kids out of school. Um, Actually, one of my daughters, my daughter was not in school at the time. She'd been kicked out of school for poor behavior.
This
So,
is the 13-year-old?
yeah, I guess, but at that point in time, she was almost 14. Yeah.
So in addition to PDD-NOS, which was a milder form of autism, which your oldest daughter got, that diagnosis, she also was diagnosed with what other kinds of things? They were more like psychiatric disorders, right?
Yeah. Well, I don't want to get into all the details of that, if you don't mind, because because of her own privacy.
Oh yeah.
But yeah, there were some really serious diagnoses. 4 or 5 different diagnoses, and where they also assured me that her future was not very bright.
And I see that a lot with my former clients who had more moderate to severe autism. They got a lot better. They didn't really look like they had autism anymore. And then people try to go like, well, we think it's an emotional disturbance, or we think this, and they start, trying to diagnose something, and it's really just autism, but with treatment, it looks different. And then you couple on medical issues or other things that can spur on. It is very common, much more common. I don't know if you have the statistics, I don't, but much more common for higher functioning, higher language kids to get multiple diagnoses, get sometimes the wrong diagnoses, that sort of thing. So,
especially females.
Really?
Yeah, she was very, very verbal, and quite intelligent as well. So she did well in school, and so nobody really knew what it was. I mean, I think that's why she got so many different diagnoses. They didn't recognize what it was, and it got so bad at the time that she was severely aggressive and self-harming.
Oh, yeah. And I see that even with my friends' kids. I've had a few friends who have reached out to me on a personal basis, and they have typically developing kids, no autism in the history, no developmental delay, and they suddenly have like an acute psychiatric disorder. They're cutting or they're having suicidal ideations, and as a nurse, as a behavior analyst, I have offered them assistance in terms of, this is what I would look at. This is the way I would work with your physician. And I did a podcast interview with Lucas's psychiatrist, Dr. Michael Murray, which is one of my all-time favorite podcasts. It's episode number 28. We can link into the show notes. But
I love that one. I listened to that.
You listened to that, yeah. And we talk about the DNA swab test, which measures the child's DNA or adult, and then kind of runs through all the medications the child could be taking, and runs it through their DNA to see which ones are really good for that DNA. And so and we talk all about that in episode 28, but that's one of the pieces of advice, is if you have a child with or without autism, who's having getting a psychiatric diagnosis or having some kind of psychiatric issues, to really look at the DNA swabs, look at things like, in my new book, I talk a little bit about PANS and PANDAS, and I am going to have a guest on about that in the future too, because there can be all kinds of medical things or trauma, or a lot of things can cause people to look like they have
Self-harm.
a serious mental health issue.
Mm-hmm.
And I mean, part of why you wanted to come on and why you agreed to come on, and you have permission to, talk about your story from your kids without using their names or really specific information, is you want to get the word out that no matter what the diagnosis is, delays, differences, behavioral issues, mental health issues, they can be improved and they can be turned around.
Yes,
And
yeah, exactly. And I wish I had known that information that you shared from the podcast 28 from the psychiatrist. If I had known that at the time, that would have really saved me a lot of trouble. Now we're behind a little bit in the Netherlands compared to the States. So yeah. Anyway, we had tried various forms of medication that were not effective with her. So that would have been wonderful to know.
yeah, because a lot of times you're just playing, chasing your tail, and it's kind of like a whack-a-mole, and kids get on these cocktails of meds and their behaviors seem to worsen, or like Lucas can't tell you if he's having a side effect. So you really, our kids can't afford to trial and error, go
No,
through trial and error. It's not
no,
fair to them.
no. My daughter was telling me just really 2 days ago. She said, "Mom, you remember when I was on Ritalin?" She says, "I was high all the time." And I didn't know how to tell you.
Wow.
She said she
Wow.
had these twitches, and I'm so glad we got her off that medication.
Yeah, yeah.
Yeah.
And not, every child and adult is different. Like for Lucas,
Oh yeah.
he is on a cardiac med, Inderol, that has completely changed his life for the better.
Yeah.
And so,
Yeah.
but your kids are now all adults. So we're going to
Yeah.
fast forward. You did ABA for your two sons. You got your other children, with various therapies. And worked with professionals, worked with whoever you could find to
Yeah.
help you, right?
Yeah, I did find a BCBA here in the Netherlands. Now there are like 23 BCBAs in Holland, but then there was one.
Wow.
No, I don't even know if there was one actually. She was studying. She was a BCABA at the time. Yeah,
Okay.
yeah.
Okay.
And then later on, the person who was helping me became a BCBA. Mm-hmm.
Okay. So you got some behavioral help. You knew that ABA was the way to go, at least for your twins. And
Mm-hmm.
then as your older children, got diagnosed too, they were already in school, they were already having different issues. And, did you use behavioral strategies for them? Did you,
Yeah.
how did that look? Because a lot of people think like, oh, of course, for a 3-year-old that works, and with severe, symptoms. But what about for your 8 and 13-year-old that looked very different? What was the use of ABA helpful?
Oh, absolutely. Well, the BCBA at the time, she came up with a behavior plan for all of the children, and it was different for all of them. Um, for one thing, we had English speaking and Dutch speaking, what we called trainers then at the time, students who were trained in ABA. And so we worked with all the children, and specifically the youngest, in Dutch and English. But then we also had a behavior plan for both of the kids, for both of the older kids as well. And we saw a lot of changes because of that. The youngest, they had such difficulty with toilet training, and with the BIP, it wasn't even called that back then, but with the behavior plan, they immediately learned how to go to the toilet, something I'd been struggling with forever. And my daughter, she learned, I learned how to give attention to the behavior that we wanted to see more frequently, and to give less attention to unwanted behavior. And there were huge improvements, really dramatic improvements. Also with my son, who was 8 years old at the time of the diagnosis. And of course, this was a process of about 3 or 4 years that we were working really intensively with these kids. I stayed at home and worked with them, and then I enrolled in an ABA program myself, because ABA care is expensive, and I had a good budget from the government. I arranged that. I had to fight really hard for it, but I got it. And
was the ABA care that you got funded by the government, was that just for the younger two?
no,
Or was that for all four? All four.
all four.
Wow.
Yeah.
Wow.
But and
they great.
started out with really small budgets, and then I could show them the proof of how much it was helping. And then they were just practically throwing money at me by the time I was finished. They were really happy with the improvements. Yeah.
Wow. So before we tell our listeners about your 4 kids now, just briefly, but so the boys you said had severe autism and low IQs. And a lot of people, when they hear that, they think like, well, a child who has autism, plus they have a diagnosis of intellectual disability or a low IQ below 70, like that's static. There's no changing that. That's a different kind of autism, and you're not going to be able to turn things around with that. But you have told me that your twins now have an above average IQ, that their IQ really soared. So are you saying that you believe IQs can be changed, speech improvements can be made, and behavioral reductions can happen?
Well, the way I see it is that children have they get the DNA from their parents, and when parents have a higher IQ, then the children can have a higher IQ as well. But they're not the children with autism, because of their difficulties in communication and the lack of intrinsic motivation, they aren't able to show the possibilities completely. So the way I see it is when we use ABA with our children, we helped them to motivate them to want to communicate and to be active participants in life, in our world. And every year we had a different IQ measurement. I had a student who was living across the street, and she was learning to do diagnostics at the time. So she practiced on us, and she was supervised, of course, by licensed psychologists. So they were actual really accurate tests. But they started out with an IQ of 53. That was the performal IQ. So actually the verbal IQ was lower, and that was about 46 at the time.
Wow.
And then we saw them every year gain about 10 to 15 points. And that went on until they were 12. And then I stopped testing them, because then they showed an IQ of 139 and 143.
Wow. And that is a gifted IQ.
Yeah. Yeah.
Because normal IQ, well, Joe average is 100, but above 130 is gifted, or
I think even 120 is already gifted. Yeah. But the higher you get past 120, the more gifted a person is.
So you actually have done your own studies to show that IQ can be improved.
Right. And I even have the tests to prove it.
Which is amazing. And are all 4 of your kids conversational now?
All 4 of them, absolutely. Yeah. And very free also with their opinion and their emotions. And, they're absolutely not robots. Like you hear that kind of talk, if you teach your child with ABA, you teach them to be robots, but no, they have their own individualities. Even the twins, they each have chosen their own way. We even had a program. at one point in time to teach them about being in love. And they even had girlfriends when they were 7 years old. It's really cute.
And your other two kids, so all your two older
Yeah.
kids graduated from college?
Yeah. One has a bachelor and the other has a master's, and they all have talents also, really extreme talents, like musically gifted. They're amazing artists, and they're also very quite athletic. That flexibility also comes with autism. So I see, some gymnastic, dancing skills and that within the family.
Wow.
They didn't get that from me or my husband for that matter.
Wow, that's amazing. So, yeah, it sounds like a real miraculous story of four kids on the spectrum at some point on the spectrum in their lives, and now really thriving and
With
with
relationships and
relationships, with their
jobs.
and intelligence, with their living
They're leaders.
independently.
They're leaders
They're,
in their field,
wow.
actually. Yeah, it's quite amazing.
And
And
do
my
they
daughter
talk
has
about their own autism?
no, well, I always told them, your diagnosis, it's just a bunch of behavioral traits. That there's no DNA test right now that can say you have autism that I'm aware of. Maybe
No, I don't
yeah.
think so. It
So
is behavioral symptoms,
they're
and
behavioral symptoms, and you can learn the skills. And so they never really were so worried about their diagnosis. They don't, yeah. And we don't worry about it one way or the other now either. I feel like they're just incredibly talented. I think that autism can bring great talents, but it's up to us to give them the right treatment and bring out these talents, motivate them,
right, right.
reward them,
And what do
make
you
it
say to
fun.
people that say, you know, ABA is cruel, ABA, is is not the right treatment. Autism is a gift. We should just accept kids wherever they are and not use ABA treatment. What do you say to that?
Well, I think if I look at it in a different way, knowing what I know now, I would see it as extreme cruelty on my part not to treat them with ABA. Knowing what I know and how far a person can come. So I do respect people in their own opinion. Maybe they have come across professionals who were not using ABA in the proper manner. I know things have changed a lot throughout the years, so it did have and occasionally has a bad name. But I think when you have a really quality care provider, a board certified behavior analyst in these days, I think that you can be quite sure that the care that's provided is optimal and the best available for your child.
Yeah. So at what point, how old were your kids or what year was it when you decided, you know what, I'm going to become a board certified behavior analyst myself?
Well, it was after I had helped many other children, not just my own children, but I also helped other children to achieve the same type of um, skills that my children have achieved, and I saw them also functioning better within their family life and less behavior issues. And I thought, wow, I really need to learn to do this better so I can teach more people. And that's why I wanted to become a BCBA. And
Yeah.
yeah,
So you have become a BCBA in what year?
officially it was 2019. It was a long journey because I spent so much time with my kids and my work and going to school. A mother of four kept me busy, and And now I'm actually doing my PhD so I
Oh,
can
wow.
help even more people. Yeah, I want to do research and help even more. So, yeah.
Wow. Sounds like we are lockstep. You're getting a PhD and we have so much in common. It's crazy.
It is. So just a few
Um,
years behind you.
yeah, yeah. So in a few years ago, you also took my verbal behavior bundle, which is how I got to know you a little bit.
Hmm.
And you were telling me before we started recording that your kids were already, 10 or so, like your kids were a little older, or maybe they were even older than that.
I think so,
Um,
yeah.
yeah, but you were using the course
16. Yeah.
to help
Other
the
kids.
kids, your clients, the verbal
Mhm.
behavior bundle. So, can you tell the professionals and even parents out there, like, what kind of things you learned from the course, even though you had ABA implemented and you were becoming a BCBA yourself?
Oh, everything. It's gold. I love it. I recommend it to all the families and all the professionals that I work with. I recommend it to, actually. So because it gives you really the basic skills in ABA. I actually didn't know about the course until it was recommended to me by a parent. So that's what got me started with your toddler course. Actually,
Yeah. Oh,
yeah,
okay. Okay. That
yeah,
was
yeah.
2017. Okay.
Yeah,
So it was later.
she shared it with me, and then I decided to become a member and do the courses myself. And I thought, oh, I wish I had known this, years before. It would have saved me a lot of hardship in trying to figure out everything, because everything is just laid out exactly what you need to do. I wish if I were a mother now with a child being diagnosed, it would be so much easier.
Yeah.
Just
What do you
following your
say to
courses.
parents who are like, I just want to be the parent. I don't want to be like Jennifer and Mary, where you roll up your sleeves and you become behavior analysts. Like, what do you say to parents like that?
What I tell the parents, actually, and I can say this because I'm a parent, is that I say that you are the best teacher for your parents. You are the one who, for your children, I'm sorry, you are the one who knows your child the best, better than anyone else, who can help him better than you. You need to be knowledgeable. You need to learn how to help your child. But I also tell them the first person they need to work on is themselves. So, um, sometimes, parents have certain behaviors, and I had those behaviors too, honestly. Sometimes you just don't know how to handle these kids, and it gets so frustrating. When you learn the skills, you can help your child without hurting them. It can be very positive and loving experience, actually. But it's they're responsible. They're the ones who are ultimately responsible. We are, as parents, ultimately responsible for our child's future. So if we don't do it, nobody else is going to do it. The professionals are there for only so many hours, and such a short time. And as parents, we are there for the lifetime of our kids. We have
Yeah.
to do the work.
And I tell people in my book, parents, my goal is to empower and teach the parents how to become the captain of the ship, to identify the right professionals, the right treatment, the right order of things. And because you're right, like the parents are the ones with the highest motivation, up all night trying to research better ideas. When you see toileting work, you're like, wow. Or I struggled with getting Lucas to sleep in his own bed through the night for 10 years. And then I met with a BCBA just by chance, just like at a dinner, and she told me three things to do. I set my mind to it. I did those three things, and within 3 nights, Lucas slept in his own bed through the night for the rest of his life.
Yeah, yeah, that's amazing, right?
And that is all in my new book, in the chapter on sleep, which when I was writing my first book, and I think I mentioned this on another podcast, but when I was writing my first book, in 2006, I was writing it. I was published the verbal behavior approach in 2007. But when I was writing it, my husband said, whatever you do not put anything about sleep in that book because like you don't know what you're doing. And I don't know, we don't know what we're doing in terms of sleep. So there's not one piece of sleep advice in my first book. But then I started traveling and I met this BCBA who gave me this wonderful advice. And there's a whole chapter because I've gotten dozens of kids to sleep through the night now in their own bed. But when you like parents, sleep, eating, potty training, going to the doctor's, dentist, haircuts, this is what is key.
Right. Oh my gosh, I can't tell you how many soiled diapers and underwear I had to deal with until I had the BCBA come by and help me. And she just said, you're following a chaining process and you're accidentally rewarding them for pooping in their underwear. And here's how you can do it. And it was just like you, miraculously within 2 days, they were toilet trained. Something I had been working with for years.
Right.
Really.
Or I had been trying to teach Lucas categories, things that are red, things that are green, things that are yellow for years. Or I tried to teach him same, different for years. And I learned 3 things or 5 things. And I came back and put my mind to it. Same, different. I taught him in 16 trials after struggling for over 5 years.
Right.
And it's like, wow. And so if we get all of this information to parents when their child is just showing signs of autism, just having a speech delay or not pointing or not responding to their name or rocking or, having those kind of behaviors, and you start to empower the parents to detect and treat anything.
Yeah.
Like
empowering them.
Yeah, with information that is in some ways complicated, but in other ways it's pretty straightforward. Like you, Jennifer, I love hearing these stories, and it's like you are a completely empowered parent professional now because whatever comes your way, whether it's a grandchild or a niece or a nephew or your own kid struggles with something else, okay, assess the situation, make a plan, put proven strategies in place, evaluate using data. This isn't to say that more stuff isn't coming down the pike for either of us, but once you have the power to know that you can make things better.
It can be used for so many things.
So any advice for professionals out there? How can they really work on parent professional collaboration more?
Well, I think that you really have to listen to the parents, really, really dig deep and listen to them and find out what their challenges are. You have to get to know them. You have to build up a relationship so they'll confide in you, feel safe with you, and then they really open up to you and are open to help. Once you can give a few tips and strategies that will help them, they will come to you for more help. And then at that point in time, you really have to train them. You really have to make, actually in our organization, we do also, we have a behavior plan, well, not a behavior plan, but a teaching plan for parents. And we score that as well. We give them a task analysis to help their child with behavior intervention plans. And it works great. And then once they've achieved that, then we can give different strategies. And it works out really well. Every time that their child gets help, then the parents also get help. Parent training. It's so important. It's the most important part of the treatment process. I'm sure, I know you know that because you're focused almost entirely on the parent training. And that's
I know when I was working with the Pennsylvania Verbal Behavior Project, we would write a behavior plan and then we would do a treatment integrity form, which basically a task analysis, step by step, what what procedures are recommended, and then
Yeah.
we would use it to train the parents and train the staff, and then we could also monitor and say, you can't just say, well, the behavior plan's not working or it's a mess when no one's implementing what's in the behavior plan. And so, like, I love that. So you work at, tell us about where you work and what you do there to help others.
Yeah, well, it's called ABA Center International, and I work with mostly young children, some teenagers and adults. We have a school-based clinic in Amsterdam. We do home training, home sessions, and school sessions, and we're working on starting up. We're actually working on starting up a school in Amsterdam. There are many children that are not able to attend school in the Netherlands, so we want to get them into school, and they have the same rights to attend school as children without a diagnosis, without behavior issues. But we have to give the teachers and the parents the tools to help them to achieve that and to help them to succeed. They get sometimes so locked into this into failing, and it's difficult to break that cycle. But with ABA, you can do that.
Yeah. So people can look at your website. What's your
Yeah,
website?
it's www.abacenterinternational.com.
Okay,
Yep. Yep.
abacenterinternational.com. Awesome. Okay, so we have just a little bit more time here, Jennifer. This is so good. I'm loving this conversation. So, any parting advice you have for parents of any child at any age and any ability level?
Well, keep in mind, if you're having doubts, if you're having concerns, don't wait too long. Go and find a professional who will really listen to you and take your doubts and your concerns seriously. If you reach a dead end with one person, check with someone else, because we all want our children to succeed. So we don't have these sort of concerns for nothing. We have them for a reason. So listen to your intuition, listen to yourself, and don't feel responsible um, for the struggles and the difficulties that your children come across. I actually had a BCBA once. I remember this very clearly. I remember crying at the time that my children were diagnosed, and I said to her, um, I feel so guilty, because I didn't play with the little ones, the twins, as much as I did my older children, and it must be the reason why they have diagnosis. And she explained to me about how the ABC works, and antecedent behavior consequence, and explained to me that it also works the other way around. That if I'm trying to make contact with my children and they are not responding to my attempts, then I, as a parent, make less and less attempts. And I just didn't know how to reach them at the time, and that's okay. And then it was just kind of from that point in time, I really, really respected and loved the BCBA who helped me, and to bring me to that point, to teach me that I'm doing the best I can, and with the right tools I can help more effectively. And that's my advice to all parents. Yeah, just find the right care provider.
Right. And I think that's great advice. Don't be in denial like I was. Don't feel guilty. One of my pediatricians told me, you know, it shouldn't be work to teach your child to talk.
No.
And if it is work, that means that there are delays, and back when Lucas was showing signs, you know, I was thinking, well, we should have done more. We should have gotten speech earlier. We should have, and it's like, it shouldn't take work. Kids should pick this up naturally. And for
Yeah.
as complex as language is, it's amazing how kids typically developing do pick it up. But that's why I wrote my new book, Turn Autism Around, because it's like I needed this book over 2 decades ago. You needed this book when your kids
Yeah.
were 3 and not talking and biting each other. And I really just want to get the information in the hands of as many people as possible. So if you haven't ordered the book, turnautismaround.com. And I know Jennifer's read some of it. She's also participated in my online course. And I really think that um, with the rate of autism and the rate of delays, we just need to learn ourselves. I also wanted to mention this, as I did send Jennifer an article called that I wrote and published called "The Experiences of Autism Mothers Who Become Behavior Analysts: A Qualitative Study," and I published that in 2007. And you had never seen that article before, but it really does show that those of us like Jennifer and myself who have been moms of kids with autism first and then go on to behavior analysts, it's a very unique situation. It's more common than we think, but we have a unique sense of how it all goes together.
Right. Yeah, I have a couple of friends who are BCBAs with children on the spectrum, and I think it brings completely different perspective to our work. You know, I sometimes I see that all the kids is a little bit my children. You know, it's kind of funny. Do you have that too sometimes?
Yeah. I don't see kids individually anymore.
Mm-hmm.
But a lot of my former clients and I just want parents to get on it. You don't have to become a behavior analyst, but you can't just sit back and um, try to find professionals to help in all areas, because the more involved you get and the more knowledgeable you get, the better your kids are going to do.
Yeah.
No matter what. No matter if that looks like Lucas's level of functioning, which is far below what your 4 kids are. But it's not about comparing kids. It's about getting each child to his or her fullest potential and being as safe, as independent, and as happy as possible. And that's what I preach. That's what you preach. And your story of hope, I really do love it. And I appreciate your kids giving you permission to come on and talk about their journeys in some way, and your willingness to come and share your story both as a parent and as a professional.
Yeah. Well, thank you for having me. And
Yes.
yeah.
One final question. I know my listeners always like this when I ask. Part of my podcast goals are for parents and professionals to be less stressed and lead happier lives. So, any final tips on ways you reduce your stress or self-care strategies?
Yeah. Well, I do remember when my boys were quite young, my husband and I took a vacation, just the two of us, and it took a lot of work to make the preparations to do so, and we had to get the right people in our home working with our kids to be able to entrust them in their care. But that was amazing. It's so important to have that. Sometimes you forget your spouse and all of the concerns with your children's development. And that was just a way for us to find each other. We actually went sailing in Greece and the islands just on a private sailboat, just the two of us. And it was so romantic. And now lately I've learned how to meditate too, and all sorts of other ways to relax. But that's probably my best advice, is to find some time to spend with your partner and with your friends if you don't have a partner. But look for some other form of satisfaction outside of the family. It's okay. Don't feel guilty about that. Once in a while, you need to refuel so you can be a better mom.
Yeah, definitely. All right. Well, it's been such a pleasure talking with you today. Thank you so much for sharing your story. I'm sure our listeners are going to love it. And abacenterinternational.com to follow Jennifer and for more information about the services she provides in the Netherlands.
Thank you so
So,
much.
yeah, it's been great. So I'll see you within our group membership and look forward to lots of contact in the future too, because we are on a mission to really help the world
Yeah,
by getting ABA strategies and parent professional collaboration out as much as possible.
yeah. Thanks very much.
If you're a parent or early intervention professional working with young children with signs of autism, or if you're a parent or professional helping older children with moderate to severe autism, you'll definitely want to order my new Turn Autism Around book today. You'll get access to all the book resources that will help you right away. For all the details, go to turnautismaround.com.